In addition to American Heart Health Month, it is also Black History Month. So this morning, our health insider, Dr. Shad Marvasti, is joining us to dig deeper into heart disease and how it affects the African American community. Good morning, Dr. Shad.
Good morning, Noelani.
So African Americans are at a higher risk for heart disease. Why is that?
Well, one of the main reasons is because of a lack of access to care and also higher rates of the risk factors for heart disease, including high blood pressure, high cholesterol, and actually chronic stress from systemic structural racism, which actually these microaggressions that many Black Americans face create chronic inflammation, which actually leads to heart disease. And so that's why the American Heart Association, it's been over 5 years now where they made that statement where they found that the life expectancy for Black Americans was less than white Americans, really because of higher rates of heart disease and stroke.
Your zip code can matter more than your genetic code when it comes to your risk for heart disease. So, how do we try to take action and balance those inequities in healthcare and access?
Absolutely. When we look at life expectancy just here in the Valley of the Sun, between, when you just drive about 15, 20 miles from North Scottsdale to South Phoenix, you lose about 15 years of life expectancy. So what we need to do is we need to empower access to care. We need to empower health education and really overcome the vestiges of slavery and systemic structural racism in our society to be able to provide equity of care and health promoting opportunities, whether it's folks who are living in food deserts getting access to healthy food, or people who are living in unsafe neighborhoods that don't have access to playgrounds or recreational facilities to get that cardiovascular exercise that is needed for heart health. All of these things can make a huge difference.
And I know there are a lot of great programs happening in the Valley that are trying to chip away and make that difference. But the reality is that heart health is still a major issue. People are having heart attacks at younger ages, especially this past year. More Americans have suffered a cardiac issue. So for everyone out there, if you see someone having a heart attack, what do we do?
So 911 is the first thing you want to do if you suspect that someone is having a heart attack. And then while you're waiting for 911, you want to make sure that they're seated or actually lying down in order to decrease the work that the heart has to do to pump blood throughout the body. If you have aspirin available, that's something that could be life-saving in the situation of a heart attack, and for them to chew the aspirin. If it's someone that you know who has high blood pressure, they didn't take their blood pressure medication, all of these things, obviously, depending on what you know. But even more important is how we can prevent that from happening in the first place. And thankfully, much of that prevention is in our hands in terms of how these are things that are socially determined. So how we live, how we provide resources for all, and ensure that people have access to opportunities to have healthy lifestyles. All that makes a huge difference in terms of prevention.
There's still so much work to be done, but even having these conversations is a great jumping off point. And next week, we will be going in deeper and really talk about the most important part of all of this, of how to prevent, treat, and even reverse heart disease for everyone. So that's next weekend on ABC 15 weekend mornings. And in the meantime, if you have questions or topics in the health related field that you'd like to hear from our health insiders, email us healthinsider@abc15.com. Dr. Shad, thank you so much for this important conversation.
Thank you.